We're gathered together today to address America's drug and opioid crisis, and a crisis it is, which now claims 70,000 lives a year. 1 year ago, I addressed the nation in this very room and declared the opioid crisis a national public health emergency.
Across the United States, over 130 people die of a drug overdose every day. As of last year, around 10 million Americans aged 12 and up reportedly misused opioids. According to the National Drug Abuse Institute, 21 to 29% of people prescribed opioids for chronic pain misused them, and 8 to 12% of those people developed an addiction to opioids. So how does a lack of government oversight pertaining to Big Pharma contribute to the rising issue of opioid abuse in the United States?
The opioid crisis really began in 1991, when opioid-related deaths started to increase as a result of the increase in opioid prescriptions for pain treatment. This increase in opioid prescriptions was facilitated by reassurances by pharmaceutical companies given to prescribers, claiming that the risk of addiction to prescription opioids was low and unlikely.
The problem is, that discussion became dominated by the pharmaceutical industry, who started amplifying the message that opioids should not just be used for acute pain, like that from cancer or surgery, but for all sorts of pain, like arthritis and backaches.
Prior to this, opioids were notorious for their use with cancer treatment. However, in 1991, pharmaceutical companies began to promote the use of opioids for pain non-related to cancer patients. By 1999, 86% of patients who consistently used opioids were using them for treatment not related to pain caused by cancer. In 2013, another increase in opioid-related deaths began. The production of synthetic opioids, such as fentanyl, directly contributed to the significant increase in deaths. In 2016, there was a reported 20,000 deaths from fentanyl and other related drugs. The U.S. Centers for Disease Control and Prevention, or the CDC, is constantly working to reduce the risk and maximize the benefits of available pain treatment options. But the opioid crisis continues to destroy families and lives across the United States.
Generally speaking, opioids are most typically used to treat pain. However, problems can arise from this vague usage of opioids. Physicians can prescribe opioids to patients without really understanding the specifics of their condition.
And Purdue's overall message of a quick, easy cure for pain was very appealing, especially for primary care doctors who might only have 15 minutes to treat a patient.
Physicians got in the habit of prescribing opioids, or arguably overprescribing, is because at one point, because I'd say the healthcare system doesn't do a terrific job of treating pain, there is something appealing about the opioids that makes them want to continue to take them and take them in increasing amounts. And I think it's a combination of both systems issues and individual issues.
Congress has to step up as well. And this is not just the president's responsibility, but every person sitting up here and every other member of the 535 of you know about this problem. You didn't need my report. My report gives you some good recommendations, but what you know is that people are dying in your district every day. And so I'd say, what are members of Congress doing as well to demand that this be done?
In the last few years, the availability of synthetic opioids for certain treatments has created a significant problem for the United States. Drugs like fentanyl can be acquired through a prescription from a physician or illegitimate sources.
The treatments we have are somewhat challenged by the potency of the synthetics, and therefore how challenging it is to treat people who are addicted to synthetics. So for example, it was not uncommon, 5 or 10 years ago for sure, for patients to do what we call doctor shop. So, they would come to me, get a prescription from me, unbeknownst to me, go to another doctor down the street, get a prescription for them. And so this was kind of feeding that addiction.
People want change from the government that would reduce the effects of the opioid crisis. Legislation has been gradual over the past few decades, but people want more prominent and adequate initiative.
I can't tell you how many stories I heard from people who were running for office in, say, 10 years ago, or maybe less than that, who were unaware that there was an opioid crisis, but who, during the campaign, learned from when they asked constituents or potential constituents, what's on your mind? a surprising response at the time was, well, you got to do something about this opioid crisis. Because by that time, pretty much everybody, in the country had some effect from the crisis.
The opioid epidemic is a serious issue nationwide which should not be ignored. The purpose of this video is to address how severe an issue the opioid epidemic is in the United States. The 2020 presidential candidates need to have a plan for how to combat the crisis. Lives are continuously being lost, and without practical change, the country as a whole will continue to suffer tremendously.